Hello and welcome to 72 Dragons House. Today we had the pleasure of speaking with Norma Quintanilla. Norma Quintanilla is working to advancing the nation's medical and public health readiness for disaster. With over 5 years of dedicated experience, her background includes a Master of Science in Global Infectious Disease and a Bachelor of Science in Global and Community Health, reflecting her commitment to improving national and international preparedness for emergencies. Welcome to this interview, Norma Quintanilla.
Good morning. Thank you. Thank you for having me. I appreciate it.
Can you elaborate on your role as project coordinator at the National Center for Disaster Medicine and Public Health, and how the organization contributes to disaster health research and educational activities?
I oversee oversee and help support the education portfolio at the center. And like you said earlier, we help to advance the nation's medical and public health readiness for disaster through research, through education. So I'm more so been focused on disaster research, helping to create training or curricula to help those who are either in the front lines or out there, working in policy. So our research can help to support those policies, having that, background knowledge. And so one of the things that I've been part of is supporting the disaster health core curriculum that the center launched back in 2018. And right now we're currently revising the disaster health core competencies that the curriculum is based on. So hopefully this time next year, we'll present the findings at APHA of what we kind of what we think needs to be changed, and hopefully that means that we will then add on to the existing curricula. The good thing about that is it's publicly available, it's free, and you get free CEs. So it's a win-win for those working in public health. Another big initiative that the center works for or supports, better say, is the Stop the Bleed campaign. So it's a grassroots campaign that started under I think not the previous administration, but the former presidential administration. And it's really just, it's working to empower laypersons to respond to severe trauma, severe bleeding. So me, you, anybody, if we're in an event, we know what to do, and it's either knowing how to successfully apply a tourniquet or knowing when to apply pressure. And so our the concept behind that is that, I'm technically the first responder until, public health professionals arrive. If you're in an incident, God forbid, in a mass shooting event or something, if you know how to do it technically, you'll be able to, in theory, right? If you have the right skill set, save that person's life before paramedics, arrive. So we now have that curricula translated into 9 languages, soon to be 10, because we're adding Hebrew to it. So you can find that at the ncdph.usuhs website. So, yeah.
Great.
Yeah.
Now, we are at APHA annual meeting 2023, and it's a great platform for sharing with others. So what are your hopes for this meeting? What would you hope to take away from the 2023 APHA?
So aside from being part of the Latino caucus, I'm also one of the co-chairs for the injury Control and Emergency Health Services Subcommittee as well. One of the things that I'm also working on is one, spreading the word about that subcommittee and working to revamp a subtopic group that focuses on emergency health services and disaster preparedness. But disaster preparedness really, it's a cross section of various disciplines, I would say. And so I'm trying to get people involved that work in EPI, that work in disaster behavioral health, that work with, climate change issues, and get them involved as well to be part of that subcommittee. And then that way we can better plan for next year, add on to, some of these poster sessions, oral sessions for next year, because it hasn't been as active, unfortunately, like many things since the, COVID-19 pandemic.
Great.
And then, another thing is also, speaking about the Latino Caucus, one, getting to hear what other folks have worked on, in 2023, celebrating the 50 years as well, and one, seeing people that I haven't seen in a long time. And I think not only can they learn from what I've been doing, but I can also learn from them, and without knowing we're mentoring each other,
Great. Now, how do you or your organization collaborate with various academic disciplines, governmental and non-governmental organizations, and the private sector in your role as a coordinator of the National Center for Medicine and Public Health?
So we're a very unique entity, and sometimes it can be a little bit challenging to explain kind of how the center is housed, because it was founded by 5 federal agencies, but the university is housed within the Uniformed Services University within DoD. So we're part academic and then part federal, and then the workers also, most of us are government contractors, and the government contractors are within this like nonprofit organization. But the center right now, under like a new leadership, we're hoping to, I guess previously that hasn't, how can I better say this? Like, it's many of our federal partners, folks in academia, folks in the private sector, NGOs, they probably haven't seen us this, like how I'm about to describe it, but technically we're trying to be like brokers. So we're trying to be the ones that can help you network, or we have the contact in the federal space, in academia, in NGOs, in the private sector, to collaborate and work on projects that, one, help to advance disaster preparedness. So be prepared for the next, unfortunately, outbreak or disaster. So we're trying to be like that middle person, you need someone from HHS, DOD. We have the contacts, you reach out to us, and we can, see where we can work together. That's kind of how we're trying to project ourselves now.
Very important work.
Yeah.
So now, what advice would you give to someone who is interested in a graduate degree, or somebody who is interested in working on disaster relief? What would be your advice?
Okay, I kind of see that as like 2 questions. One, graduate degree. Reflecting on how I, was ambitious and motivated to get a graduate degree. One, don't be afraid to ask. Don't be afraid to, if you're currently like in school or working, ask your peers. Don't be afraid to, reach out to your advisor, your professors. They are a fabulous resource. And sometimes I feel like students see it as like, either embarrassing or, haven't quite built up the guts to be like, let's start a conversation. I want to know how you got to, be, focus in your field of study. Besides teaching, you did something before, or you probably do two things simultaneously. Ask if you're in work. See if you can shadow someone or start conversations with your coworkers. Honestly, that has served me a lot in my current field because of the having the opportunity to network and have multiple collaborators. I always enjoy talking, over lunch or, working on a project, and I pick their brain. I'm like, you know what? I kind of want to do this, or you know what? This is why I now want to go into infectious diseases, right? As opposed to like doing something else in public health. So don't be afraid to ask. And chances are those people want to share their experiences with the next generation. And so I have a saying that someone told me, and for right now, it's stuck in my brain. She was retiring from the DoD, the Department of Defense, and she said to me, you know what? Don't ever say like, oh, I'm gonna pay you back, right? Because we had lunch or you helped me with something. You want to say you're gonna pay it forward. You're gonna pay it forward to another person that's gonna follow you. So I'm like, you know what? I need to start doing that more. And now shifting to working in disaster preparedness. From what I've seen, there's not a lot of programs, I think, right now that are focused on disaster preparedness. I can only think of right now one, and that's I think Columbia University has a program. But if not, even if there's not something in disaster management or disaster preparedness per se, you can work in disaster preparedness with an epi background, being a statistician, being someone who works in climate change. I don't know if I already said epidemiology, but because it's, across as many disciplines, we kind of need all those specialties for some of these initiatives or programs or research circled around disaster preparedness. Even, MDs as well. So nurses, I can go on.
Amazing. Norma Quintanilla, thank you so much for sharing with us today.
Thank you.
And
it's been
I'm
a
sure
pleasure.
people who are watching this video are going to benefit from your insights and your experiences. Thank you very much.
Thank you. I appreciate it.
Thank you, Norma.